Hello and welcome back to the Gluten Free RN podcast. I'm Nadine Groopman, RN, BSN, CEN, and today during episode 43, we are going to talk about celiac disease and eating disorders. Stay tuned. Hi, welcome back to podcast number 43. I'm Nadine Groopman, the Gluten Free RN. Today, during episode 43, we are going to talk about eating disorders and some other really interesting issues that come up around food. As most of you know, I had just a few weeks ago actually attended the International Celiac Disease Symposium. And a few things came up, and mostly not actually eating disorders per se, but there's a term called PWAGs. So sometimes when people aren't diagnosed with celiac disease, but they still choose to not eat it, there's a derogatory term, and I think it was actually coined by some of the celiac doctors, called PWAGs. And it's PWAGS, and it stands for people who avoid gluten. And it has been used as a derogatory term, and I'm not quite sure why. But finally, Dr. Fasano did say during the International Celiac Disease Symposium that if people chose not to eat gluten, and that was fine with that, they're finally coming around to the fact that many people, and interestingly enough, 1 out of 2 people in the United States, it used to be 33% of the population between the United States and Canada were on some form of a gluten-free diet, or people were at least trying a gluten-free diet. Now it's going to be 1 out of 2. So people are getting interested, they're getting more information. They were perhaps not getting tested, but they are actually interested in trying to feel better. But the implication with PWAGs, people who avoid gluten, is that somehow we're food crazed or obsessed. And it has actually even been mentioned also during International Celiac Disease Symposium that perhaps there is another term, another eating disorder that needs to be investigated, and that's called orthorexia nervosa. And that is a term describing people who are somewhat obsessed with eating healthy food. And I find that that is very interesting because I don't think I'm obsessed with eating healthy food, but I'm very aware of healthy food. And if given a choice, I will choose healthy food and food that is actually good for my body. So food is medicine. And if we're actually approaching it that way, then we need to maybe separate the concept that people have orthorexia nervosa, which, by the way, is not a clinical term yet, and it's not an official diagnosis. It's another one of those terms that is getting batted around and discussed and written about. I've even included several of the articles from the internet and from PubMed discussing orthorexia nervosa. But there's also some really interesting articles on other eating disorders, such as anorexia nervosa. And I became really interested as a nurse and as a person of the world with anorexia nervosa and celiac disease shortly after I got diagnosed. And I referenced this book in my book, Donation, because it was a fascinating case that Dr. Jerome Groopman, who wrote How Doctors Think in 2007, in the introduction of his book, How Doctors Think, he talks about this woman who had been mistreated, misdiagnosed, put in psychiatric hospitals, and essentially told that she was a pathological liar several times by physicians and other medical professionals because despite eating the diet that she was put on, both in hospital, in rehab centers, in treatment centers for her diagnosed anorexia nervosa, Despite eating the high carbohydrate diet that she was being fed in order to help her gain weight, she actually ended up losing a lot more weight, even in rehab or in the eating disorder clinics. So she was labeled a troublemaker, pathological liar, all kinds of things. And you can read this story in Dr. Jerome Groopman's book, How Doctors Think. It's the introduction. So her story went on about how she was hospitalized and mistreated and fed carbohydrates. And the more carbohydrates she was fed, the more weight she lost. And it wasn't until she saw one of the very last doctors she agreed to see, she just had resigned herself to essentially also going to die. And the fact that, nobody could help her, and that she had all these lists of diagnoses over the years, and, she just had given up. But she went to see this one last doctor, prompted by her boyfriend, and the doctor just listened to her story. He said, I don't want to hear what other people have actually said about you. I want to hear your story. And so she told him her story, and he said, would you please agree to do one more test? Would you please agree to an endoscopy? So he actually tested her for celiac disease. He did a biopsy, and she came back with villous atrophy, March 4, and ended up going on a gluten-free diet, and she got better. She did not have anorexia nervosa. And of course, the treatment plan for her, which was a high carbohydrate diet, which would be things like pasta and bread, were actually causing her to have increased symptoms, increased weight loss, and to continue to be sicker and sicker and sicker. So it wasn't until she saw this very last doctor that she agreed to see that she got the correct diagnosis of celiac disease, upon which she actually improved. She got better. She didn't have an eating disorder. She had celiac disease. And celiac disease and anorexia can actually look very similar to each other because you have severe weight loss, malnutrition, and despite eating, people lose weight, or they're very picky about what they do eat because they know that food causes them pain and suffering. So some people practice food avoidance because they know that food makes them sick, but they don't necessarily know which foods make them sick. And for some people, it seems like all foods make them sick. So it's extremely important that eating disorder specialists are testing for celiac disease properly before people are actually labeled with anorexia nervosa or any other eating disorder, because eating disorders can present as many different things. So for most Americans and a lot of people around the world, and this is a worldwide issue, it's currently estimated that 3% of the population now have celiac disease in the United States, which means that millions and millions of more people are undiagnosed and are struggling to get a diagnosis. And in our current healthcare system, where many, many people do not have insurance, it is a financial burden to get tested, and it's very difficult to get tested correctly, even if you find a practitioner that will do it. And then sometimes a lot of those test results get misinterpreted or read incorrectly by the practitioner. So it is extremely important that lab works are reviewed and looked at by at least someone that knows a lot about celiac disease and how the testing needs to be interpreted. Because many people think that we are food crazed or food obsessed. And it's really important for people to understand that for a long time, food actually was killing us. It's a toxin. It's a neurotoxin, and it's very difficult to tease out what is causing us to feel irritable and cranky and sick and bloated. And, most of us ate the standard American diet for most of our lives until we found out that, lo and behold, the food that we were eating, the gluten and the dairy, and for some of us, it's the soy and many different things, were causing damage to not only our intestines, but our entire bodies. and really causing damage to our immune system and leading to several layers of inflammation. And that inflammation is the basis for cardiac issues and strokes. So heart attacks, strokes, and many other signs or symptoms such as joint pain, muscle pain, and any inflammation, any itis. So for those of us that have had diagnosis of celiac disease at a later age, I got diagnosed at the age of 40, completely by accident, and thankfully so. But do keep in mind that my blood tests were negative, which means they were seronegative. So even if there was a prevalence study, I never would have been picked up, because there's more and more people that we're realizing that are in fact seronegative, which means if you draw blood tests on them, the blood test will be negative, but they still very clearly have villous atrophy. So that would have been me. And I was told I could go back to eating a regular diet because I had a negative blood test. But the reality at that point was that I knew that the food was causing me damage and it was causing me to feel bad. And the food being the gluten and the dairy, and then come to find out later, soy and a number of other things. So over time, as I've learned more about food and I've learned more about celiac disease and I've learned more about how food is medicine and chemicals that are in the certain foods, mostly grains, that those grains and the chemicals, the phytates and the lectins that are inherently in grains, can cause inflammation. And if the goal is to get rid of inflammation and allow the small intestine and the body to heal, that you actually have to remove those grains. So over time, while I might have started on just a gluten-free diet, I now am on my variation of a paleo diet, or an organic, local, whole food diet that includes 100% grass-fed beef with no antibiotics or hormones. What we're finding is that in order for people to get better, they really have to treat food as medicine. It doesn't mean we're food crazed or obsessed. It just means that we understand how important it is to eat really good food and to feed our body so that with nutrient-dense food, that is going to help us heal. So when I read Dr. Jerome Groopman's book, How Doctors Think, after I heard him on NPR, he was interviewed, I believe it was by Terry Gross, and you can look that interview up. It was quite fascinating. And I heard that interview shortly after I got diagnosed, and a huge light bulb went off, like the sun for me as a nurse, because I realized at this point that we were completely mistreating many different people. It wasn't just people diagnosed with eating disorders and, whatever eating disorder they may be diagnosed with, but that we were mistreating many different people. And if we weren't looking for celiac disease actively, then many, many millions of people were getting missed. So over the last 11 years, there have not been any major studies on eating disorders and celiac disease. Mostly what I find in the research in the PubMed or any other search engine is what I find are mostly case studies. So it's researchers or doctors or RDs that are writing up these case studies and getting them published, which is a great way to eventually get a good study done. And I cannot believe that 11 years later, we still have not done a great study on eating disorders and celiac disease, because it frequently will get missed. And it really does need to be addressed because people are being missed. And I see in every community, in the celiac community, in the paleo community, in my community in general, I see a lot of people with eating disorders. And it's not hard to recognize someone that is malnourished and potentially is anorexic and cachectic, and they don't have very much body fat. And in that case, they have hormonal disruption, which means that women probably don't have their periods. and they have thyroid issues. And it all comes down to the fact that their body is starving and they have severe malnutrition, and that needs to be corrected. Carbohydrates are typically not going to do that unless those carbohydrates are things like fruits and vegetables and real whole food that is nutrient dense. So over the years, since I've been the Gluten Free RN for now almost 11 years, I have myself had to deal with anger and contempt and scorn, and I've been called names, and there's quite a bit of anger about even talking about celiac disease or gluten intolerance, because gluten and dairy and our comfort foods, we're taught as children that these are the foods that will bring us comfort. These are the foods that, if you're feeling bad, our grandmas or our moms made us things that would make us feel better. And typically those comfort foods would have wheat and dairy in them. And so to learn that those comfort foods and the things that we were taught would make us feel better and are addictive are the things that are causing us to great harm and are causing our bodies to fall apart and be painful, that we have to give those things up. So not a lot of people want to hear about that until they're ready to hear it, or until they're sick enough that they go see the doctor or they get a diagnosis of celiac disease because they have a primary care provider who is knowledgeable about celiac disease and knows how to test for it properly. At this point, I think it's important that we talk about some of the mental health issues that go along with eating disorders. But this is not going to be a podcast on mental health disorders. We'll cover that separately. But we know that people that are malnourished and have celiac disease also have sometimes significant cognitive function impairment. That means sometimes people's brains don't work very well. And sometimes their brains don't work very well because of inflammation in the brain, hypoxia, which is decreased oxygen flow, and interestingly enough, brain atrophy. And this doesn't always just happen to people when they get older. We're finding younger and younger people that have brain atrophy, and that means their brains are shrinking. Sometimes it's their cerebellum, which we have talked about in the past. Celiac cerebellar ataxia or gluten ataxia is very well documented, but it also causes a shrinking of the cerebellum and sometimes a shrinking of the brain in general. If you can avoid that at any cost, I highly recommend that you continue to have a nice, plump, fatty brain and avoid your brain atrophying or shrinking. Because what happens is we end up with a leaky gut because we have this villous atrophy or the significant damage to our intestines. That's epithelial tissue. And we have epithelial tissue on our skin, in our lungs, in your blood-brain barrier. So if you have a leaky intestine or leaky guts or increased permeability of your intestinal wall, you also have increased permeability of your blood-brain barrier, your lungs, your blood vessels, and your skin. Anywhere that there is epithelial tissue, you end up with leaky tissue. Sometimes that means that people's blood pressure goes down or up. There's a term called POTS, P-O-T-S, postural orthostatic tachycardia syndrome. It's a fancy way to say people get dizzy because when they stand up, their blood pressure goes down and they get tachycardia or a very fast heart rate. So if your blood vessels are leaky and they're not very good at constricting and dilating, sometimes they're really good at dilating because they're leaky. So that causes people to be dizzy. And we'll talk about POTS more later. But the point I want to make is that every tissue in your body that is epithelial tissue is at risk for thinning out or not being very effective for what its job is. So your blood-brain barrier is leaky, which allows the gluten protein to get through the blood-brain barrier. And if you think that's a good idea, that's really not a good idea. So the gluten protein can cross the blood-brain barrier, and as medical professionals, we have a hard time making even medicines cross the blood-brain barrier. In the emergency department, we had what's called mannitol, and we used it for severely head-injured patients. Very similar to Lasix. What it would do is it would pull the extra fluid off the brain and decrease, hopefully, the intracranial pressure. So again, that's the only medication we had that would cross the blood-brain barrier, and it's called mannitol. But here we have a situation where those proteins, the gluten protein or the gliadin protein, will cross the blood-brain barrier, causing inflammation and thereby causing hypoxia. And hypoxia is what's known as decreased oxygen flow. And your brain needs oxygen to work appropriately, because if it doesn't have all that oxygen, you end up with what's called brain fog or difficulty thinking. Some people get mean, nasty, irritable, cranky. So go around your workplace and your neighborhood. Look in your family. Find those people that are mean, nasty, irritable, cranky, angry, and really suggest that those people get tested for celiac disease, because there is a good chance that their brain is being inflamed by these proteins. And I've said it before, and I'll say it again. Sometimes being on a gluten-free diet does not fix underlying personality disorders. But if a person's brain is inflamed or hypoxic, then if we fix that sometimes that irritability and that crankiness goes away and people can be happier. Because there's a lot of people on psychotropic medications in the United States, and I'm sure around the world. It's sometimes estimated that up to 50% of the population is on some form of a psychotropic medication. And that can be an antidepressant. It can be some type of mood-altering medication. But we know that sometimes if we change people's diet because they have celiac disease, that inflammation and that irritability and that crankiness goes away and people get their brains back. So when I talk about people getting their brains back, I'm not kidding. And there's many children from every age group that are missing school, and they miss school for a number of reasons. And they don't just miss a day here and there. Some kids are missing school for months at a time. So these kids don't want to miss school. They want to do well. And this is not a behavioral issue that can be solved by any other issue other than changing the diet. Sometimes these kids really do need to be tested and diagnosed properly with celiac disease or non-celiac gluten sensitivity. But even if they're not diagnosed, there is no downside to attempting a gluten-free, dairy-free diet for any of these children, because we know the tests are not as accurate. They're not 100% sensitive or specific for celiac disease. So we really do need to keep an open mind and allow these people at least a clinical trial of a gluten-free, dairy-free diet, if not some variation of a paleo diet, or attempting a Whole30, which basically is whole food for 30 days that you prepare with no sugar included. So you're taking sugar, gluten, all grains, legumes, which are peanuts and beans, out of the diet. Those things all cause inflammation, and you're allowing the intestines to heal. And it's a good clinical trial in that if people get better, then those proteins are a problem. They're causing malabsorption or hypoxia or changes in the gut microbiome that need to be addressed. So we know that gluten impairs the cognitive function. We know that the microbiome can be changed or disrupted based on what people are eating. So if you can have your comfort foods and you are changing your microbiome, a lot of people go through a period of time where they are feeling worse before they feel better. For some people, that can be a day. For some people, that can be a week. And for some people, that can be 2 weeks. And trust me, I've seen people go through detox from gluten and dairy, and it sometimes is not very pretty. It doesn't mean that these people need carbohydrates or gluten or dairy. It just means that their bodies have to detox from those proteins because they have a narcotic-like effect on their brain. very similar to morphine. So when you take that away, these people literally have to detox. But once they come out on the other side, they get considerably better. Their moods improve, the anxiety goes away, they're able to sleep, pain disappears, a lot of that inflammation, which causes either joint pain or migraine headaches or other neurological disorders, a lot of that gets better. Sometimes that healing process takes a year or two, but it's well worth it. Especially when you look at the alternative. If these people are just going to get worse and worse and worse, they're not going to be able to function. These kids are not going to be able to learn in school. And when you can't learn in school, it's very difficult to be a productive adult, whatever that means to you. So we have to heal the intestines, heal all of the epithelial tissue, allow the inflammation to clear up, allow the immune system to heal. And when the inflammation goes away and those proteins are no longer crossing the blood-brain barrier, then our brains can get as much oxygen as our brains need, and therefore we can think better. And of course, hopefully we are preventing any brain atrophy, which is shrinking of the brain. And that doesn't just happen to old people. We need to be aware that more and more people are developing what's called early onset dementia. People in their 30s, 40s, 50s, and ideally, we are not going to have our brain shrink or end up with brain atrophy because that's never a good idea. So we do need to be on a super good high-fat diet, and that includes avocados and olive oil, really good animal protein and fat, coconut oil, coconut milk, even hemp milk. Hemp milk is a really good source of omega-3 and omega-6 fatty acids, essential fatty acids, and they're called essential fatty acids for a reason, because they are essential, and our brain needs them. Our entire nervous system needs those fatty acids. So let's start treating food as medicine and making sure that we are, in fact, eating nutrient-dense foods. And we're not food crazy or food obsessed, other than the fact that I want to eat the best food and have it be tasty and easy to prepare and food that everybody likes and eats. In that sense, I am food crazy. I do want to avoid gluten and dairy and several other things at all costs, which means that I won't eat if I don't have safe food available, or if there's any risk that the food is contaminated with gluten, because I know how damaging that gluten can be, even just a very tiny amount, a breadcrumb or a dusting of flour. That cross-contamination can trigger an autoimmune response or immunological response that can last for days or weeks. And I don't want to feel bad, and I know I don't want anyone else to feel bad. And it is very important that we avoid gluten. And sometimes I think that can make us sound crazy or appear to be crazy. But the reality is we all know how damaging even that breadcrumb can be, or that dusting of flour, or that cross-contamination from the oil that French fries are cooked in, or personal care products. It's very important that we're very aware of what we are putting on and in our bodies. So you can call me a PWAG if you want. I've been called worse things, trust me. But I do avoid gluten. I'm one of those people who avoids gluten like the plague, because it is in fact the plague. For some of us that have celiac disease and non-celiac gluten sensitivity. And when you add up all those people that have celiac disease and non-celiac gluten sensitivity, we are talking about millions of people. We don't all have an eating disorder. And it is very important to recognize when somebody with an eating disorder or malabsorption or malnutrition has in fact celiac disease, whether that person is cachectic or super thin, or if that person is overweight. Many of us were what was considered normal weight, despite having what I would call crap fat. Crap fat was fat I couldn't get rid of no matter what I did, no matter how much I exercised. It never went away until I went on a gluten-free diet. And then it just seemed to miraculously melt away. So the issue with any eating disorder is identifying what the underlying cause is and then treating it appropriately. as with any other physical or mental or emotional diagnosis. So we have to look. We can't just assume that it's just a surface issue. We have to look deeper. We have to find the underlying cause. What's preventing people from eating good food? What's preventing them from absorbing nutrients? And we really do have to dig for those answers sometimes. And we have to be advocates not only for ourselves, but for our children, and sometimes for our parents and other family members. So be that advocate, be that support person, ask the correct questions, and don't take no for an answer. And allow those cranky people to be cranky, but always do suggest that they get tested for celiac disease, because there's a good chance that crankiness and irritability and angry behavior is potentially from brain inflammation. And we want everybody to be happy as much as possible because it improves everybody's quality of life. So thank you very much for listening. Once again, this is podcast number 43. We're talking about eating disorders and celiac disease. We talked about PWAGs, or people who avoid gluten. And that is really irritating to me that it's used in a derogatory way. But that's fine if that's what, I want those scientists, I want those doctors that actually call people PWAGs to get tested for celiac disease themselves. And if they're positive, then they're more than welcome to join us, and they can be a PWAG also. This is my opportunity to thank all of you for listening worldwide. And if you would be so kind as to leave a rating and a review on iTunes or wherever you find the Gluten Free RN podcast, I very much appreciate it. And it helps other people find the Gluten Free RN podcast so that they can get this great information too. So if you think celiac disease and non-celiac gluten sensitivity don't affect you, your family, or your friends, please think again. This affects all of us, whether you're a doctor or a nurse, some other form of healthcare provider, or a teacher, people from every walk of life, in every country, worldwide. Whether you're rich or you're poor, it doesn't matter. Everybody should have the opportunity to feel as good as they humanly possibly can, and to have the highest quality of life that is humanly possible. And we need to start really approaching food as medicine and a tool to heal our bodies. Until next time, I'm Nadine Gruskowiak, the Gluten Free RN. Thank you very much for joining me, and best of luck to you. Bye.